How to treat and cure hepatitis. Hepatitis is an inflammation of the liver. The condition can be self-limiting or can progress to fibrosis, scarring, cirrhosis or liver cancer. Hepatitis viruses are the most common cause of hepatitis in the world, but other infections, toxic substances, for example alcohol, certain drugs, and autoimmune diseases can also cause hepatitis. There are 5 main hepatitis viruses, referred to as types A, B, C, D and E. These 5 types are of greatest concern because of the burden of illness and death they cause and the potential for outbreaks and epidemic spread. In particular, types B and C lead to chronic disease in hundreds of millions of people and, together, are the most common cause of liver cirrhosis and cancer. Hepatitis A and E are typically caused by ingestion of contaminated food or water. Hepatitis B, C and D usually occur as a result of parenteral contact with infected body fluids. Common modes of transmission for these viruses include receipt of contaminated blood or blood products, invasive medical procedures using contaminated equipment, and for hepatitis B transmission from mother to baby at birth, from family member to child, and also by sexual contact. Acute infection may occur with limited or no symptoms, or may include symptoms such as jaundice, yellowing of the skin and eyes, dark urine, extreme fatigue, nausea, vomiting and abdominal pain. Scientists have identified 5 unique hepatitis viruses, identified by the letters A, B, C, D, and E. While all cause liver disease, they vary in important ways. Hepatitis virus, HAV, is present in the feces of infected persons and is most often transmitted through consumption of contaminated water or food. Certain sex practices can also spread HAV. Infections are in many cases mild, with most people making a full recovery and remaining immune from further HAV infections. However, HAV infections can also be severe and life-threatening. Most people in areas of the world with poor sanitation have been infected with this virus. Safe and effective vaccines are available to prevent HAV. Hepatitis B virus, HBV, is transmitted through exposure to infective blood, semen, and other body fluids. HBV can be transmitted from infected mothers to infants at the time of birth or from family member to infant in early childhood. Transmission may also occur through transfusions of HPV-contaminated blood and blood products, contaminated injections during medical procedures, and through injection drug use. HPV also poses a risk to healthcare workers who sustain accidental needle stick injuries while caring for infected HPV patients. Safe and effective vaccines are available to prevent HPV. Hepatitis C virus, HCV, is mostly transmitted through exposure to infective blood. This may happen through transfusions of HCV-contaminated blood and blood products, contaminated injections during medical procedures, and through injection drug use. Sexual transmission is also possible, but is much less common. There is no vaccine for HCV. Hepatitis D virus, HDV, infections occur only in those who are infected with HBV. The dual infection of HDV and HBV can result in a more serious disease and worse outcome. Hepatitis B vaccines provide protection from HDV infection. Hepatitis C virus, HEV, is mostly transmitted through consumption of contaminated water or food. HEV is a common cause of hepatitis outbreaks in developing parts of the world and is increasingly recognized as an important cause of disease in developed countries. Safe and effective vaccines to prevent HEV infection have been developed but are not widely available. Acute infection. Acute infection with hepatitis B usually does not require treatment. In rare cases, however, the infection may cause life-threatening liver failure. Patients with liver failure due to acute hepatitis B should be evaluated for liver transplantation. Chronic infection. If a person is chronically infected with hepatitis B and has few signs or symptoms of complications, Medications usually are not used. These patients are watched carefully and given periodic blood tests. One test measures the viral load, that is, the amount of viral DNA in the blood. Doctors will recommend treatment if there are signs that the virus is beginning to cause damage or if the viral load is high. Another reason to prescribe medication is if the patient has a positive test for the hepatitis B antigen, BAG, in the blood. BAG is associated with an increased risk of progression of liver disease and its complications. In chronic hepatitis B, the goal of treatment is to reduce the risk of complications including cirrhosis and liver failure. However, it takes decades for complications to occur, which makes it difficult to study the effect of medications. As a substitute for waiting years to find out what happens, scientists have used tests like the viral load or liver function tests to evaluate if medicines are working. This is logical because it is known that people who have large amounts of the virus in their blood are at highest risk to get cirrhosis. Up to 1/3 of people with very high viral loads, more than 1 million viral copies per milliliter of blood, will develop cirrhosis over a decade, compared to only 4.5% of those with low viral loads, fewer than 300 viral copies per milliliter. Medications can reduce the number of viruses in the body and may be able to eliminate the virus from the bloodstream. Logically, this should lead to them having a low rate of progression to cirrhosis, 1% per year, although large, long-term studies have not been done. Even in people who clear the virus from their blood, low numbers of viruses still live in the liver and other cells. Thus, the medications do not cure the disease, but they can prevent or delay complications and symptoms. People who have a good response to treatment can still transmit the virus. Doctors follow blood tests that measure viral load and liver function, and they may recommend liver biopsies to evaluate if the medications are working. The medications in current use for chronic hepatitis B include the interferons and nucleotide analogs. New agents are being developed, although they are still under investigation and considered experimental. There are no accepted guidelines that tell how every patient should be treated. As a result, treatment is individualized. Interferon alpha has been used to treat hepatitis B for more than 20 years. Interferon alpha is a naturally occurring protein that is made in the body by white blood cells to combat viral infections. In addition to its direct antiviral effects, interferon works against the hepatitis B virus by stimulating the body's immune system to clear the virus. Compared to older interferon alpha agents, pegylated interferon alpha, marketed as Pegasys or Pegintrin, has a more convenient dosing schedule, may be slightly more effective, and suppresses the virus for a longer period of time. Pegylated interferon alpha is given once a week for 48 weeks. A significant reduction in the viral load or elimination of detectable viral DNA from the blood occurs in 25% to 37% of people during treatment. Blood tests for liver functions normalize in approximately 23% to 39% people treated with interferon or pegylated interferon. People who have significant abnormalities in liver function before therapy are more likely to respond to treatment. Those who have normal liver blood tests before treatment are less likely to respond to interferon therapy. Liver biopsy results show improvement in about 1/3 of patients. Only 27% to 34% of people who have hepatitis B antigen, BAG, in their blood will be able to eliminate BAG and produce antibodies against the B antigen after treatment with interferon. Relapse may occur after treatment is stopped. Sustained response, undetectable viral load in the blood, normal liver function tests, occurs in approximately 15% to 30% of patients after the drug is stopped. Although this is not a cure, some virus still lives in the liver and elsewhere. People with sustained response are at low risk for complications of liver disease. If the responder's immune system is compromised, for example through the use of steroids or acquiring HIV, the disease can recur. Periodic monitoring of blood tests can help confirm that the response continues to be sustained. There are no clear guidelines to recommend which agent to use first in treating chronic hepatitis B, as there are multiple options. Interferon is given for a defined period of time and may have a more prolonged response after the medication is discontinued than NAS.